my Heent exam today. We're examining here in the Cox South ER, and we're gonna go get started. We walk in the room. We did hand hygiene walking in. Introduce myself to the patient. We'll ask the patient, their name and date of birth, just to confirm we have the right patient. And, hi, what's your name and date of birth?
8988.
All right, that works too. So first of all, we're checking with the patient. We're checking the skin, just overall looking, appearance. Everything looks okay there. The posture, she's sitting up. Speech is clear. Do you know what the date is?
9/7/16.
All right, just basic questions. She's obviously learning oriented times 4. So then we're gonna move on to the head. We're just kind of check things like look in the scalp, things that is dry, no obvious contusion or lacerations, anything like that. Any damages, feel for the skull for any kind of skull fractures, stuff like that. There's nothing there. She's good to go. Everything's intact. Let's see. I guess we can check her sinuses too. Just kind of feel around. They don't inflame. Do you have any pain in your sinuses or sniffling, headache, anything like that?
Yep.
No, we're good to go? All right. I'm going to go ahead and move on to the eyes then. Check for their peripheral vision first. So just tell me when you see my fingers, okay?
Okay. Okay.
All right.
Okay. Okay. Okay.
All right. So peripheries is fine. I'm going to go ahead and use the otoscope and check for the red exam real quick. What I'm checking for is to see if I can see that red reflection and not any of the white things that would indicate glaucoma or anything like that. So right to right, I'm going in. That one looks okay. Start back, work my way into a foot in. Again, same, looks good. So there I was testing for, everything looks okay. We had that red reflective that we would get when we would do the red exam. We had the 6 cardinal signs to check for the different cranial moves and for the muscle movements in your eyes. So I just asked, can you follow my finger? From here, side, and down, the same way, up, side, and down. She followed those, showing that all her cranial nerves there are fine and her muscle movement is going to work out. Inspecting that, we're going to check for her reactivity under her light. So we'll just look in the eyes, see if they're reactive. They're reactive. She has paralysis. The pupils are equal reactive to light. They accommodate correctly. Everything looks okay there. If we were to do a Snellen chart, we have 2 ways to do that here. We have a Snellen chart back there. You can stand back 20 feet or so and you can look there and read down as far as they can to check out how far their eyes, and you cover each individual eye to see if there's different troubles. We also have these handy dandy little cards here. You can hold it 14 inches. And from there you can also do a real quick eye exam. We'll move on from there. We'll do the ears. You can just you'll look at the external part of the ears, make sure there's no damage. You'll kind of pull on them, make sure there's no pain there, showing any kind of ear infection or muscle tenderness from that. Nothing's going on there. So then, again, we'll have the otoscope. Put on a different tip again. We're going to inspect her.
She's right here, blue button. Can you take patient upstairs?
We'll go ahead and check the otoscope and check her ears. Alright. Make sure they're clear of wax and things like that. Okay. Now the membranes look okay. Everything it looks alright. Not any wax buildup in there or anything. Same in this one. Nothing going on. We'll do a whisper test normally. We'll go up to the patient, say a whisper, say things whether they can hear you or not, kind of testing their ability to hear and stuff like that. And she can clearly hear because she has to work with me every night. So then we move on to the nose. Just kind of checking it for symmetry, any visible, fractures or anything like that. It's straight and aligned and everything like that. Then we'll take again. We can go back to our otoscope and we can look up her nose to see if there's any mucus or any flare-ups or anything like that. So we can check in there. I can get in there. And they both look just fine. So move on from there. Everything's okay, no mucus, no redness, no swelling, no fracture or anything. Checking her mouth. So first we'll look at things like her gums, her teeth, make sure that those are, if not bleeding or inflamed with her gums, and her buccal mucosa to make sure that's not all chewed up or anything. So again, I could use this or whatever, any kind of light to really just look in her mouth, make sure everything looks okay there. If I was having a real hard time looking in there, I'd use a tongue depressor, push down to kind of look around and stuff. As far as her uvula, we can take a look at that just using the basic light. See if she has a gag reflex. We could use a tongue depressor, just push it back there, push the back of the throat, or she can say ah. I'm not gonna do that, but so if you just say ah for me, check your uvula. All right, it moves up, it pulls up when she says ah. She's gonna have a gag reflex there, and everything muscle-wise and everything back there is functioning just fine. No sores in her mouth, no clear signs of infection. Her tonsils look fine, they're normal size, no kind of inflammation or anything there. Then from there, we'll just kind of move on to her neck. Feel for any visible deformities or anything, or her lymph nodes, see if those are inflamed or not. They feel fine. Feel for the, her jugular neck veins, those feel fine. And again, for her thyroid, just kind of put my hand on it right here and ask her to swallow to feel if there's anything. If you swallow for me. All right. It feels all right. We could also have her take a sip of water when she does that. Make sure there's no deformities or enlarged or anything like that. As far as that, can you move your head left to right? Range of motion's all there. She's got muscle intact, and that's it. Thank you.